Good morning, dear students. Today we will proceed with our fourth class of studying anatomy together. Today our topic is cartilage. Now to say about the cartilage, we have already said in our last class that it is a component of our skeletal system. All the basic model of the skeletal system, in fact, is built up on the cartilage model, from where the ossification and calcification procedure make the adult skeleton or the adult bones. Now, coming on to in our next class, but beforehand, let's revise some part of our previous class. We have in the previous class said about the skeletal system. What does it mean? The components forming the skeletal system, bones forming the axial skeleton, and appendicular skeleton. This is about the dried bone and the total count of 206 within a human body, an adult human. Now, one of the very important part of the skeletal system is the cartilage. To say about the cartilage is roughly bluish white tissue as seen by naked eyes. It is a specialized connective tissue that is in other name known as sclerous tissue also, or under the broad heading of sclerous tissue, we get the bone and the cartilage. This part will be covered in your general anatomy class. Now, cartilage is a substance which is rigid. At the same time, it allows elasticity. So it is present in those areas which requires to be rigid, and at the same time, it allows elasticity. That cartilage may be temporary or permanent. As most of the models of formation of the adult bone is cartilaginous beforehand, and within the cartilaginous model, the ossification starts and the adult bone develops. So these bones, which were previously cartilaginous model and converting to bone, are the temporary cartilage. And in some areas of our body, there are some cartilages which remain lifelong. They are in the cartilage form. There may be a little bit of calcification in those cartilage, but they are having the configuration of the cartilage and doing the function of. So those cartilages are the permanent cartilage. Now, in the component part of the cartilage, we will encounter the cartilage cells that we have already said in our last presentation. They are the chondroblast and the chondrocytes. Other than the cartilage cells, we will see abundant intercellular matrix to support the cartilage cells, to surround the cartilage cells. In fact, the intercellular matrix is secreted via the cartilage cells itself. There is a substance known as the chondroitin sulfate, which in hydrated gel form bound to the protein and the collagen fibers. So three main ingredients to form a cartilage, any sort of. That is cartilage cells. Second, intercellular substances. And third is different sorts of fibers. Cartilage, as per its nature, is avascular and non-nervous. Vascular means presence of vessels. That means any structure in your body requires its nutrition via the vessels. The vessels are carrying the nutrition and taking out the waste product from that area. So these are like pipeline circulation coming from the and going into the heart.
But cartilage is such a structure
where no direct this blood vessel circulation is present. So it is avascular. A means absence, absence of vessels, so it is avascular. It is non-nervous. So any nerve fiber does not traverses through the cartilages. Now, as we say that the cartilage is avascular, But any of the tissue within your body cannot live without nutrition. So there are some procedure to reach the vascularity of the nutrition to the cartilage, such as this is one of the area of the epiphyseal cartilage. Epiphyseal cartilage, what is epiphysis? I will say in bone class. But you know, it is the region of the cartilage. It is known as the growth plate, where the cartilage is gradually converting to bone and increasing the length of the bone. So this is the region, that is the cartilage region or the epiphyseal cartilage. So also at the end of the long bones, you will get the articular cartilage. They are all covered by somewhere via a single layered lined by known as the perichondrium. Peri means lying at the surrounding. Perichondrium. Chondrium means cartilage. So there are some vessels supplying the perichondrium. And the nutrition from there via the process of diffusion reaches to the cartilage. This is one procedure. Second procedure is at the articular cartilage at the end of the bones, and these bones forming the joints having synovial cavity filled with synovial fluid. So again, via the process of diffusion, some amount of nutrition from the synovial fluid reaches to the cartilage. But at the deep side of the cartilage, most inner side of the cartilage, these vessels cannot reach, where there is formation of some vascular canals through which the vessels traverses. But the vascular canals are all surrounded by the layer of the perichondrium. So directly the vessel's wall does not come in direct circulation of the cartilage. Thus the term in case of vascularity of the cartilage, that is it is avascular, is correctly delineated. And this way the nutrition of the cartilage occurs. Now in the histogenesis part of the cartilage, there are some undifferentiated mesenchymal cells. Undifferentiated mesenchymal cells are present in the embryos, which goes on proliferating and giving rise to huge number of different types of cell lines within your body. So some of them do differentiate to form the chondroblast. The chondroblast increase in size. As do they increase in size, they do proliferate also. And at the same time, they will secrete the intercellular substances surrounding them. And they are themselves converted to mature chondrocytes, which loses or lessens the capacity of proliferation. Now, the cartilage grows by the process known as appositional and interstitial method. These two terms we will again get in growth of bones also. Now, what does these two terms means? But beforehand, you get the process of intercellular matrix of the cartilage formation. That is, the chondrocytes secrete two enzymes. One is phosphodilase and one is alkaline phosphatase. Now, each of the chondroblast chondrocytes are rich in glycogen inside the cells. And this glycogen is converted to sugar phosphate via the process of phosphorylase, by the action of the enzyme known as phosphorylase. Now, alkaline phosphatase is another enzyme secreted by the chondrocytes, which will hydrolyze these sugar phosphates to free phosphate ion, to release the phosphate ion. And these free phosphate ion will combine with the calcium available in the matrix to form the calcium phosphate. And now the calcium phosphate is an inorganic and dead material. So if a dead material is depositing surrounding the chondrocytes, so how the field will be? The field will be dead. The field will be thickened. So that through which the nutrition cannot reach onto the chondrocytes. And gradually the cartilage cells die. And the process of this to deposition of the calcium phosphate inside the cartilaginous matrix is known as the calcification. The same way it occurs in bones also. But as soon as the calcification occurs in growing cartilaginous matrix. The calcified matrix cartilage cells die and the matrix weakens. Now, within this weakened matrix, bone cells invades with the vessels and the cartilage cells lying onto top of it. There is procedure I will show in details in the growth of the bone. So it is a basic cartilaginous model which is getting died off and where the bone cells invade to start ossification to form the bone. Now, as I have said already, the two methods of growth of the bone, one is the appositional method and one is the interstitial method. So via the appositional method, the bone increases in girth. See that was the initial diameter of the structure that both way for the bones and so also the cartilage. And this is the after growth. So this is occurring via the cells surrounding at the periphery surrounding below or underneath the perichondrium, so that the cartilage deposits at the surrounding, increasing the girth. And interstitial growth occurs from the center of the mass, So it proliferates both way, so that the cartilaginous model or even the bony model, this is true for bones also, increases in length. So via the appositional method, the tissue, either cartilage or bone, increases in girth, and by the interstitial method, it grows from the center and the mass increases in length. Now, depending on the amount of the cells lying in the cell matrix, along with the fibers, its orientation, its relative amount, cartilage are grossly classified into embryonic cellular cartilage, hyaline cartilage, white fibrocartilage, and yellow elastic cartilage. Now, to say about this is the embryonic cellular cartilage. They are embryonic model because in the embryo, inside the mother's womb, there is huge proliferation of cells from the undifferentiated mesenchymal cells. So they do form clustered cell masses. And these cell masses then gradually starts functioning of secreting the intercellular matrix, and then subsequent different types of another cartilages are formed. So this is the embryonic form. These are rarely found in case of adults. And these, after the embryonic form, depending on the amount of the fibers, intercellular matrix, and the cell types count, the adult cartilage or the cartilage found in adults, they are divided in three types. One is hyaline, one is white fibrocartilage, and one is yellow elastic cartilage. Coming to the term, that is hyaline cartilage. Now, the hyaline cartilage, the name came from the Latin word hyalinus. In Greek, it is called hyalinos or hyalos, all meaning to glassy. Glassy means looks like glass, looks like transparent masses because of the appearance of the ground substances. And they are mainly found in the articular cartilage that are capping the end of the long bones. And so also they are mainly capping the end of the bones at the region of the joints. The hyaline cartilage also found in tracheobronchial tree. They form the basic model of all long bones, which are cartilaginous in ossification, and epiphyseal cartilage, which is the growth plate. See, if this is a long bone and this is another long bone, both are articulating here to form the joint. So the end of the long bone here and here, they are capped, they are covered via a layer of cartilage, which is hyaline in nature. Now see, this is the rib cage. These are the 12 pair of ribs coming from the either side, meeting the sternum, and from the either side, the anterior end of the ribs articulating with the sternum remain cartilaginous, and they are called the costal cartilages. Costi meaning to rib. The cartilage, that is hyaline cartilage, is present inside the larynx, that is the sound box, and the tracheobronchial tree. Most of the cartilage here in the larynx are hyaline in nature, mainly the thyroid cartilage, the arytenoid cartilage, except at its apex and the tip of the vocal process, the cricoid cartilage. Here in the tracheobronchial tree, you will get series of C-shaped cartilage known as the tracheal cartilage, altogether around 12 to 20 in numbers. And the cartilage proceeds up till the tertiary bronchus. Tertiary bronchus is the terminal site up till where the cartilage we see in the wall of the airways. After that, the bronchioles start, and the bronchiole does not have cartilage in its wall. This is the hyaline cartilage seen under microscope. You will see this cartilage as a cartilage site, as an example of the sclerous tissue. And so also, this is the identification point for the tracheobronchial tree or the tracheal, even the respiratory system slides. The hyaline cartilage, like any other, they are covered by a layer of single cell membrane known as the perichondrium. The cartilage cells with advancing age may calcify. Here under the microscope, you can see the cells are lying in cell nest. They are lying in cluster of 2 to 4 cells together. And the adjacent side of the cells are flat. And these cells, that is 2 to 4 in cluster, are known as the cell nest. And these cells do secrete the intracellular substances, and the intercellular substances are deposited surrounding the cell nest. These are known as territorial matrix. Now, in between the cell cluster, that is cell nest, and the territorial matrix, there is a zone look like vacant, look like a cavity within which the cell nest lies, and these are known as the lacunae. And see onto the ground glass appearance because of the basophilic nature of the staining of the ground glass substances, as it's contain huge amount of chondroitin sulfate. And the appearance of the tissue, that is a hyaline cartilage under the microscope, is glass-like. It's purplish, light purplish in color. Here in the histology, you will get very few fibers and this ground glass appearance, which is the identification point for the hyaline cartilage, from where the name is extracted. Seeing onto the fibrocartilage, as the name says, there is huge amount of fiber in it. The Latin word fibro, meaning to the fibrous tissue, they are found in the meniscus of your knee, which are intra-articular cartilage. Clear these two terms, articular cartilage and interarticular cartilage. I'm just coming to explain. They are present in between the two vertebrae, forming the intervertebral disc. They are present in the joint capsule, ligaments, and tendons. Seeing onto the histological features, fibrocartilage. In the histology, in fibrocartilage, you can see thick bundles of collagen fiber, very few amount of matrix, and the cells are again lying in bundles arranged in lines. They are ovoid in shape, and they are lying in between the bundles of the fiber. They are lying in between the bundles of the fiber. So these are the typical appearance of the fibrocartilages. Now the fibrocartilages are found in between the two vertebrae. This is the zone of intervertebral disc. Intervertebral disc. It is present inside our vertebral column. So this is one very important site. So also here, this is the region of the symphysis pubis, where two hip bone meets anteriorly, or it is been highlighted. The black coloration at the edge of the body of the pubis is hyaline in nature. Okay, but in this joint, the center of the symphysis pubis, here in white color, is fibrocartilage. This is articular cartilage lining the cap or the heads of the articular surfaces, and this is within the joint. So this is intra-articular cartilage. and this is the fibrocartilage. Here inside the knee, this region is hyaline cartilage because they are articular cartilage. But as soon as it is in the joint cavity, inside the joint, two cartilage present. These are known as the meniscus, one placed medially, medial meniscus, one placed laterally, lateral meniscus. They are fibrocartilage because they are intra-articular. So also here, the joint between the lateral end of the clavicle with the scapula, acromion process. So the joint named as acromioclavicular joint. And within this joint, you can see here the end of the bone meet. The lining cartilage is hyaline, it is articular cartilage. And this is intra-articular disc, which is fibrocartilage. Within the joint cavity, any cartilage is present. Mostly it is fibrocartilage. And at the end, the cartilage lining the end of the joint or end of the bone to form the joint, it is the hyaline cartilage. The muscles forming tendon attach somewhere to the bone for their attachment. So at that site or at the site of the tendon is attaching with the bone, there are some fibrocartilage present. Now coming to the elastic cartilage, as the name says, it is flexible. All the cartilages are flexible in nature, but this is specifically said as elastos, is a Greek term meaning to be flexible. These are present onto the external ear, the pinna, outside your body. Eustachian tube, it is the tube or the pharyngotympanic tube. It is communicating the middle ear cavity with the pharynx. They are also present in the larynx or the sound box. As you can see in the elastic cartilage, as the name says, it is rich in elastic fibers. They have, and the fibers do branch and again unite. Within the branching fibers, the cell nests are present in case of elastic cartilage. And like any other cartilage, it is also having a perichondria. This is an example of the external ear, that is the pinna having the yellow elastic cartilage. Most of the cartilage of the larynx is hyaline cartilage. Only the epiglottis, the corniculate and the cuneiform cartilage, the apex, and the tip of the vocal process of the arytenoid cartilage. These are elastic cartilage. So next part of studying anatomy together, we will learn about bones. Again, very specifically of each of the cartilage that you have just studied. Go revising on yourself. I will advise every one of you make your own short notes. And the related question that can come from this topic are each of the cartilages with their distribution, histological finding, etc. can come as short note. And this is very important topic of the distribution of the cartilages in your MCQ. And gradually, as you will go on learning more and more about the cartilages, the particular one, injury to the meniscus or any other site, costal cartilage injury, like that, that will be much more interesting for you because you will correlate with the clinics. So these are the probable question and the facts about the cartilages. We will try to revise each of the cartilages in details if positive as small lectures in future sometime. And in the next class, we will proceed with the general anatomy of bones and thereafter to the proper study of the bones and with its landmarks and different anatomical terms. So thank you, dear students, for your patience. Happy learning.